All right, I think we should start because we don't have too much time left, and we'd like to hear very briefly from each of these discussion groups, only a few minutes each. And we'll hold questions and discussion till the end if we have time. I think we'll eventually have everyone up here from all of the groups. And so let me start on this side with Kate.
Okay, so I'm going to report back from the prevention discussion. And it was really wonderful to be here today and be a part of the discussion, out of everyone together and really talking about what seemed like moving forward and where to go from here. In this group, we talked about how PEPFAR is meeting and exceeding new targets for condom distribution, for male circumcision that they hope to meet by the end of the year, the 4 million men, looking at OVC in a very holistic way, family-centered, looking at economic strengthening, trying to get countries to move forward in talking about key populations, vulnerable populations, and that it's really the focus on combining the biomedical, behavioral, structural components is really very important and key in moving forward, and that we're glad that kind of the vertical nature of the programming is ending to some extent, that we're trying to bring all of that together. We really couldn't agree more. As one person said, there needs to be a strong evidence base, and that is being created, and the acknowledgement that this was a program set up during as an emergency response, and that now we're able to do more of these activities, and we're looking forward to the different studies and measures and things that are going to be coming out of the group, and the collaboration with the countries that will be coming. One thing that was noted was how it's interesting and unexpected, perhaps, that the most progress in the reduction of new infections has happened in those countries with their generalized epidemics rather than concentrated epidemics, and that we seem more comfortable with that. And we are, I don't think that was the word that was used, that we know more how to address the generalized epidemics, and that we can use the power of PEPFAR to also address issues amongst the concentrated epidemics, and that we've seen PEPFAR's ability to do this in other areas, and can, if so desired, use that in the future. So kind of in summary, kind of combining the behavioral, the biomedical, the structural components together, whether it was around children that was talked about, needing to integrate infant, child care, adult care, making sure that we don't lose ground in where we've come to, so that we don't assume that we know how to do PMTCT, and so we've done that, when we still have a huge effort to make. So how do we move forward with the things that we need to continue to do and advance and do better, while not losing ground in what we've already achieved, and doing this all with possibly more limited budgets?
Thank you, Kate. I think we'll go straight on, as I said, and not have questions at this point. Livia?
I'm reporting back on the health system strengthening work group, where we also had a very rich and fruitful discussion. We first heard about PEPFAR's many efforts and successes around health system strengthening, and some of the new and continuing efforts, including in the areas of human resources for health, human resource information systems, which seems to be a large focus, supply chain management, policy reform, and building financial management at partner country level, amongst many other things. And that was what PEPFAR opened up with. We also, in the discussion, one of the things that emerged was, is the WHO model of building blocks too static? The report was built around the building blocks, and everyone is using those building blocks when they talk about health system strengthening. But does the model need to be more integrated and dynamic? Because all the issues and the solutions are really across the building blocks. So we had some discussion about that. We also talked about issues around innovation in health system strengthening. Some of the implementation science agenda is in this area. And one of the things that really came out is how do you capture and replicate the experiences when you do these efforts? They happen across countries in different places, but are the best models really being shared? And what are the ways that we can do that? An example was given in the area of service integration. There's been work done in that, but are the lessons being learned and shared? We also spoke quite a bit about leadership and governance. The issue was raised that this report did not really address the issues of accountability, corruption, and transparency. PEPFAR does have an increased effort on expenditure analysis. There were some pilot countries, and now this has been systematized and is a large effort that will be done annually across countries. So the hope is that this will help to address some of those issues. PEPFAR has also done a lot of work, continuing in the area of leadership and governance. PEPFAR has done a lot of work on policy reform across countries, and it was mentioned that, you know, when you look across all the countries, the policies, there's over 500 different types of policies that are being worked on, or, you know, with PEPFAR's help. And the implementation of these policies, however, is very difficult to measure, and figuring out which policies are the best ones to promote across countries is also very difficult. And that may be one thing that PEPFAR can do moving forward, is prioritizing some of these policies, you know, the ones that potentially have the largest impact, to help with that. But the issue of measurement was really something that came out, as it's come out across other areas, was something that also emerged in health system strengthening. And for example, measuring policy implementation, even if you can look at the policies, measuring the implementation of those policies is very, very difficult, and is hard to do. I think another thing that came out is really measuring the impact of health system strengthening in general, and does it have an impact on health outcomes, which is really the largest question, and measurement of that is really a challenge. So I think that that was really one of the overriding messages, was the struggle with measurement across these areas. OGAC did agree with the recommendation, which is recommendation 9.1, that was put out by the committee, and welcomed it as an opportunity to really focus its efforts and be able to draw attention to health system strengthening.
Thank you, Livia. I think we'll go to the other end of the table. Maggie, you want to report?
Great. I'm reporting back on the knowledge management breakout session, and we too had a very rich dialogue and are grateful for all the people that were present and participated. And I couldn't summarize everything that we were discussing, but I'll highlight some of the key points. It really focused, our discussion focused around OGAC's response to the recommendations, and then also the tensions that exist in developing and implementing knowledge management systems for large initiatives. And then also we talked for a while about capacity building for evaluation and research. And really, in terms of the recommendations, we discussed how the IRM recommendations are a convergence of thinking that has been, that there are ideas that have been coming out in OGAC, as well as some GAO recommendations and some scientific advisory board recommendations. So it was nice to hear that the IRM recommendations were in line with a lot of these. And some of the key things we heard going forward from OGAC were that they would continue to bring forward the implementation science continuum, but they would make more explicit their framework for knowledge management that would put everything together in a single package that has the objectives for knowledge management, the questions that knowledge management will try to address, the data sources that will be used, and all with the goal of achieving an AIDS-free generation. In terms of indicators, we heard that OGAC has a tiered system for indicators, but they plan to re-examine it and further flesh it out. And they acknowledge the tension of minimalizing the burden of reporting, but also the need to get the necessary data to manage the program. And that the indicators will be reviewed, and there will be new indicators that will be introduced and piloted. And there is an acknowledgement in the challenges of collecting data on outcome measures. In terms of dissemination, there was an agreement that there is a need for an overall strategy for dissemination, and OGAC plans to improve their data sharing in terms of working to improve access to reports, publications, but also raw data. But they are looking internally around discussions of what data there is and what can be shared, and also looking at questions of who owns the data. In terms of research and evaluation, it was acknowledged that PEPFAR is an evidence-based program, but it is also first and foremost a humanitarian assistance program, and that all research and evaluation should feed back into that. And so they are, we'll look at questions of what questions in the global knowledge base should be addressed by PEPFAR, but what should be addressed by others outside of PEPFAR. Then a lot of the discussion focused around the structural tensions that exist in implementing knowledge management systems for large initiatives, such as the reporting burden as versus data gaps that exist, or then that information needs vary across stakeholders, and that not everything that you want information on is easily measured, but you still need measures for annual reporting and tracking. Some other tensions discussed is the need for flexible monitoring and evaluation systems that adapt to changing requirements, but the burden of changing indicators in the field and also then losing the trend across time. And so, and that knowledge sharing is important, but then it also takes time and resources to do this. So there's a lot of tensions, and we discussed those, and the goal overall is to maximize the impact, and there's no easy solutions, but it requires laying out these questions, acknowledging the tensions, assessing trade-offs, and navigating a way going forward. And finally, we discussed capacity building for research and evaluation, and that there is a deficit in countries for this for research and evaluation, and also there's a deficit in demand and hunger for the data to manage programs at the country level. So there's discussions around how to build capacity in these areas. And some of the ideas that were brought up were that capacity is an ongoing process and that it should be built and learning while doing, and that joint research would help this, as well as building the capacity of research organizations in country, as well as developing centers of excellence. And we even had the idea thrown out of a MEPI equivalent for building capacity around research and evaluation.
Thank you very much. Angelina?
Thank you very much. I'm reporting on two teams, the care and treatment group and the child and adolescent group. For the care and treatment group, we had a very rich discussion, and unfortunately we're not able to discuss almost quite a number of issues, but the main things that we did discuss were regarding the quality and efficiency of programs and the prioritization of resources within a limited budget. And we learned that PEPFAR plans to involve from the focus of numbers and targets to also measure outcomes, and these outcomes have to be measured within the context of available infrastructure and measured in such a way to give direction on the way forward. On the ground are also site monitoring systems whereby in-country teams are measuring the processes implemented by the partners using an interlinked process, an epidemiological approach, where they use data quality and service quality assessment as the step one in this process. A case study was given of Malawi that has implemented the Option B+, led by the Department of Health and HIV, and is an example of a success story in which site monitoring obtains the data, which then informs of the way forward. PEPFAR has also set up monitoring systems adaptable to the 21st century. They have technical efficiency using mobile text messages, allocative efficiency where they have resources and money being used in the most efficient way. Currently, they have a routine expenditure plan that was set up last year and is being collected annually to account for every dollar spent through a package expenditure analysis. Now, the other sector that we discussed was on non-clinical care and support, or what others were terming as social needs. And we had a very rich discussion on this, but we learned that PEPFAR is working with OVC programs to bring the social needs of patients to support HIV-positive families and in the communities, and technical assistance visits have been done to improve linkages in mapping bidirectional referrals and monthly interactions with these patients. But we realized that there is need to identify at the community level the mode of care and treatment, understand what are those psychosocial aspects like stigma, physical care issues that affect these patients, and put these experiences together and develop a sort of guideline or checklist that we can use to determine the social needs that are required, and these can then be adapted according to country-specific situations. We also discussed about the integration of facilities with limited resources, and the case of Malawi was also brought up, where they actually have support from the members of patients who are already HIV positive, who form groups amongst themselves, and they support one another. And in so doing, with that peer support, they are not able to attend the clinics that often because of the support that they have. This is an opportunity and also a means of efficiently reducing on the costs. Other issues that were discussed, or that were mentioned in the discussion but were not adequately discussed, were issues on drug resistance, but that is for another time. Now, regarding children and adolescents, we have to put into consideration that there are new guidelines that were set up for the OVCs, and these were circulated early last year. So we're working in a situation where there are already guidelines that have been put up, and some of the issues that were raised in the evaluation have actually been met or are being in the process of being met. Now, the issues that came up regarding that is that, yes, we have an issue of disaggregated data. We don't have data on children who are less than 1 year, and we need to actually map out what is going on regarding this group. Then we have also issues regarding the adolescents. The adolescents is a group that is transitioning into adulthood, and we need to find and take note of the care and treatment, adherence, stigma, and psychosocial support in this group. Then we need also to look systematically at models of what is working, and we are duty-bound to put the pediatric HIV care on the table and find out what is it that is working that can be used as an example for the other countries to adopt. It was noted that PEPFAR is also working in terms of trying to ensure that drugs for children are kept on board. There are drug perspectives where they're working with different organizations to try and ensure that drugs for children are kept on board. They're working with USAID, CDC, and OGAC. They have also advised that a lot of synergies need to be used to get the best practices that can be shared across the countries for many other countries to use as examples in their care for HIV. South Africa was used as an example in terms of community and health care, where they have identified home care visitors who are used in terms of OVC care management. They try to give psychosocial support. They try and link these children in terms of testing and care for treatment. Other examples were given for Mozambique, Zambia, and Kenya. So the OVC program is already in process in terms of caring for many of the issues that were set up for the child and adolescent group. Thank you.
Thank you. Bridget?
So I am reporting back from the gender discussion, and I will likewise apologize in advance for all of the interesting insights and thoughtful comments that I don't reflect in the summary. They did also happen. I think we started off with kind of setting the stage of the evolving conversation that is gender and HIV and gender in foreign assistance. And I would say there was kind of a mixed level of optimism. There was optimism in a lot of areas, but also recognition of how long, we have a long way to go in a lot of areas as well around gender. A few key themes that came out in terms of thinking about places where a lot of the messages in the report do align with things that PEPFAR has been thinking about and some of the future directions that the report can help to refine and encourage going forward. One is that in addition to thinking about gender programs, there was a lot of discussion about really integrating gender as a core component across all of the areas of work of PEPFAR, and that this is really a big part of the model. And something we talked about at some length is thinking not just about how those other core areas can achieve gender objectives, but also how addressing gender can help those areas achieve their own outcomes. So in some ways, those outcomes themselves can be a sense of how well or not some of the gender initiatives are working. Along those lines, there was some thinking about beyond just gender-specific programs is the important component of gender as part of efforts to reach critical populations that are vulnerable. And that's across a range of populations that basically have limited access and equity in their ability to reach services. And that is critically linked to the gender initiatives as well. So that's, some of the populations that we talked about, including men who have sex with men, who are really something that the gender focus is thinking about, but even thinking about remote geographic populations, women who are living in poverty with their families, those populations as well being a really critical area of focus. A theme was also the need for increased capacity in the field. This is something that the report talks about and that the PEPFAR representatives were also really thinking about in terms of having both gender specialists in the field who really do have the knowledge about what works and how to implement it, but also the need to have competencies around gender in the other staff, because it is such a critical component of other programs. And that's for both the US government staff who are working on mission teams, but also we talked about this importance in the implementing partners as well. The discussants raised that. And then of course the country partners. Definitely a lot of discussion about what we need to know in order to successfully do gender. So that's a theme already across topics. And this covered a lot of territory. It covered efforts to be piloting indicators in order to be able to try to develop some more outcome measures. It was talking about how you track financial resources, which is somewhat challenging in gender, which doesn't have its own separate budget code. So the money that's being invested is being tracked in other ways. And that can be a part of really trying to understand what resources are needed in addition to what's being spent. The basic ability just to know what it is we're trying to accomplish, and then to go from there to how to know whether it's being done, and really raising some of the issues around the way the program is structured. If there isn't a target, if there aren't numbers being collected and outputs being collected, is it getting the focus that other areas might get that have those things? So really having expectations set and then also a means of accounting for them was something that we talked about, and really thinking about outcomes in terms of, gender outcomes for men, women, boys, girls, but also thinking about process outcomes for how PEPFAR can know that it's achieving what it set out to achieve. Given that the report makes a specific recommendation around guidance, something that PEPFAR emphasized is an attempt going forward to try to not necessarily need to generate new information, but to synthesize a lot of existing information that's out there around gender. And an important part of that is thinking about how to put together some of the pieces that are coming from other US development assistance efforts as well. And that relationship to broader US government gender efforts is a really critical part that PEPFAR both contributes to and benefits from. So thinking about not necessarily generating, but synthesizing, and also about trying to incorporate a gender lens in the guidance for other areas being important. And I think finally, one theme that came out is that there really are a lot of difficulties in trying to address gender in the context of the legal and policy and cultural norms environment in countries, and how that makes it not an easy thing to do, and it ties to some of the discussion about really needing to be able to not only implement what is known, but also to develop an evidence base for what will be effective for these really difficult challenges that are ahead, both in terms of programs and innovations, but also just understanding what to do at scale and how to make it work at scale to get around some of those difficulties.
Last but not least, sustainability. I think we've all done a good job sustaining our energy somewhat today. So some common themes from our discussion, and I won't repeat the ones that were mainly heard because we had a lot of common themes across the groups, but the ones that were, I think, unique or really drawn out at ours was this idea that no one size fits all when we're talking about sustaining the response in different countries, and that it takes a tremendous amount of time. And just to put this in perspective, the sort of mandate to begin to look at a sustainable response to PEPFAR wasn't even put in place until about 4 years ago, and the program began implementing that probably within the year after that. So we're really in a new phase of that, moving into the next phase, which is where it should be more prevalent for the whole approach. We also talked about the need for guidance from OGAC to countries about how to do this and how to get to the tipping point, in a sense, that will allow them to sustain the response, whatever that looks like in their particular environment. We talked a lot about the importance of both terminology and communication. So on the one hand, The terminology used seems to, it definitely has an impact on how people hear what country ownership means or what sustainability means. And OGAC is moving from using the word country ownership to using sustainability because of there is perception of the country ownership concept as saying PEPFAR was going to stop providing resources to countries, and that isn't the message that is intended to be sent. So we had a discussion about what terminology used is transition makes people nervous. At the same time, we talked about the need to communicate to different audiences about sustainability. So one of those audiences raised was Congress, and if one of the messages is, well, it's not really about stopping the flow of resources, what is the message to Congress in this tight budget environment? So we discussed ways to think about that. One, the need for OGAC to do a country-by-country assessment for readiness, for not, whether you call it transition or sustainability, for how the U.S. government changes its relationship with that country. And in some cases, that may be one of reduced resources, and others it may be a shifting of the way resources are used. But that country-by-country assessment would help provide a better roadmap for what sustainability looks like, both for U.S. efforts in a financial sense, but also in a service sense. And at the end of the day, the other things we talked about for communication to, let's say, the audience of Congress was that this is a success story. We've had 2 IOM reports basically say that. We've had a lot of GAO reports say different aspects of that and other published literature. So that's part of the message. And lastly, that we are still talking about an infectious disease. So the idea of sustainability has to always be always has to be kept in mind. We also talked about the need to communicate to the field, and that different country missions and different countries are hearing the concept of sustainability and country ownership differently and potentially changing the way they position themselves on the ground, which may or may not be consistent with what OGAC is trying to communicate. So there needed to be a better communication mechanism from DC to the field about what that means. We talked a lot about civil society, and this is probably the bulk of our conversation, concerns about what happens with civil society as the U.S. government changes its relationship with host governments. Everything from the perspective of right now in some countries, the U.S. is funding civil society and what if the U.S. moves to a model where it's funding the host government? The host government in some countries won't fund civil society, yet sometimes it's civil society who's the only entity on the ground who will support certain interventions of certain populations. So what happens in those situations? Particularly if the host government has laws against the behaviors that certain key populations are associated with, gay men, commercial sex workers, injection drug users. That was a big discussion. And generally how to bolster the role of civil society writ large, since the support for civil society often doesn't come from government, from host government. So that was a big part of our discussion. We also talked a lot about the idea of diplomacy and leadership and the role that ambassadors from the U.S. play in working with host governments and civil society on interpreting and describing sustainability and actually just implementing the program. But we made the point of, while acknowledging that PEPFAR, in a sense, is at a pretty important phase diplomatically as it moves to more sustainable approaches, that should not default to politics, because after all, it is about public health and it is about an infectious disease at the end of the day. Measurement was a huge issue, as was discussed in each group. We talked about what does success look like for sustainability, what does success look like for country ownership, and I think the clearest statement that was made by several people, which I think is the most important one, is really the ultimate measure is the health outcome measure. And it's about how many infections averted, how many people treated, how many people were cared for. And if your movement to sustainability does not support those outcomes, then we're not moving to sustainability just for sustainability's sake. So I think that echoes a lot of what we heard across the other groups too.
It sounds like there was very rich discussion in all of these groups, and thank you for reporting back. We have just a few minutes for further comments or questions before I wrap up for the day. So if you're going to speak, please use the microphones. You don't have to. Last chance.